Question 1. Which of the following is the most common method for measuring behaviors that have a clear beginning and end and occur at a high rate? A. Duration recording. B. Latency recording. C. Frequency recording. D. Interval recording. Answer: C. Frequency recording. This question is asking about how we count behaviors. The keyword most common method and description clear beginning and end and occur at a high rate point to simple counting. Frequency recording is exactly that. You just make a tally mark every time the behavior happens. It's the easiest way to count behaviors that are quick and happen often, like clapping or saying a word. It wouldn't make sense to time how long they happen, duration, or record the time between them, latency or interval, if you just need a simple count of frequent behaviors. Here's a simple takeaway. If you can easily count it with tally marks, frequency is likely your best bet. Question 2. What is the primary purpose of a behavior intervention plan, BIP? A. To outline daily session activities. B. To teach academic skills. C. To provide a detailed guide for reducing challenging behavior and teaching replacement behaviors. D. To collect preference assessment data. Answer: C. To provide a detailed guide for reducing challenging behavior and teaching replacement behaviors. This question focuses on the purpose of a behavior intervention plan, or BIP. The keyword primary purpose tells you to look for the main goal. A BIP is a roadmap created by a supervisor to help the team consistently handle challenging behaviors. It doesn't just talk about the behavior we want to decrease, but also what we should teach instead, replacement behaviors, and how to do it. It's not about the whole session or just academics or preferences. It's specifically about addressing challenging behaviors effectively and safely. Think of a BIP as your instruction manual for what to do when a specific challenging behavior happens. Question 3. You are working with a client, and the supervisor asks you to track how long it takes for the client to start following an instruction after you give it. What type of measurement is this? A. Duration. B. Frequency. C. Latency. D. Interval recording. Answer: C. Latency. This question is asking about a specific type of measurement used in ABA. The clue here is how long it takes for the client to start following an instruction after you give it. This describes the time gap between something happening, the instruction, and the behavior starting. Latency is the measurement of the time from the presentation of a stimulus, like an instruction, to the initiation of a response. Duration measures how long the behavior lasts, frequency is a count, and interval recording looks at whether a behavior occurs within specific time blocks. So timing the delay before starting an instruction is definitely latency. Remember, latency is about the wait time before the behavior begins. Question 4. When implementing extinction for a behavior that is maintained by attention, what should you do when the behavior occurs? A. Provide a small amount of attention. B. Ignore the behavior completely, no attention. C. Give the client a break. D. Redirect the client to a different activity and provide attention for that activity. Answer: B. Ignore the behavior completely, no attention. This question is about extinction, specifically for a behavior that is happening because it gets attention. Extinction means withholding the reinforcement that is maintaining the behavior. If the behavior happens because the client gets attention for it, then to put it on extinction, you must stop giving attention when the behavior occurs. Options A, C, and all still provide some form of interaction or removal from the situation, which might accidentally reinforce the behavior. To truly implement extinction for attention-maintained behavior, you must consistently provide zero attention. Ignoring it, when it happens, think of it like turning off the faucet for attention when the unwanted behavior happens. Question 5. What is natural environment teaching? NET. A. Teaching skills using mass trial procedures at a table. B. Teaching skills in the client's everyday environment, using their current interests and activities. C. Teaching skills using only pictures and flashcards. D. Teaching skills by telling the client exactly what to do before they do it. Answer: B. Teaching skills in the client's everyday environment, using their current interests and activities. This question is defining natural environment teaching, or NET. The name itself is a big clue. Natural environment. This method is about teaching skills in the real world, where the client naturally interacts, plays, and learns, instead of sitting at a table doing repetitive drills, like in DTT. You use whatever the client is interested in at that moment to teach related skills. For example, if they want a toy car, you might teach them to say car or want car. It's all about making learning functional and fun within their daily routines. Think of NET as teaching on the fly, using what's happening right now. Question 6. Which document outlines the specific goals and objectives for a client's skill acquisition and behavior reduction programs? A. Session note. B. Data sheet. C. Behavior intervention plan, BIP. D. Treatment plan or service plan / individualized education program. Answer: D. Treatment plan or service plan / individualized education program. This question asks about the main document that details all of a client's goals, both for learning new skills and reducing challenging behaviors, while a BIP focuses only on challenging behaviors, and session notes and data sheets are for recording information. The treatment plan, sometimes called service plan or IEP in school settings, is the comprehensive document that includes all the specific targets the client is working on across different areas. This plan is developed by the supervisor and guides everything you do in your sessions. Keep in mind the treatment plan is the big picture document outlining all goals. Question 7. What is differential reinforcement? A. Providing reinforcement only for the desired behavior and withholding reinforcement for the unwanted behavior. B. Giving reinforcement every single time the desired behavior happens. C. Only reinforcing behavior when it occurs in a specific location. D. Punishing the unwanted behavior while ignoring the desired behavior. Answer: A. Providing reinforcement only for the desired behavior and withholding reinforcement for the unwanted behavior. This question asks about differential reinforcement. The word differential means different or making a distinction. In ABA, differential reinforcement means you are reinforcing one behavior, the desired one, while simultaneously putting another behavior, the unwanted one, on extinction. Withholding reinforcement, you are essentially teaching the client that this behavior gets the good stuff, but that behavior doesn't. It's a powerful way to build up good behaviors while decreasing challenging ones. For example, reinforcing a child for asking nicely for a toy while ignoring whining. You're reinforcing differently based on the behavior. Question 8. You are tracking a client's hitting behavior. You mark down every instance of hitting that occurs during your session. What type of measurement are you using? A. Duration. B. Frequency. C. Partial interval. D. Momentary time sampling. Answer: B. Frequency. This question describes a direct count of a behavior. The phrase "mark down every instance" means you are counting how many times the behavior happens. As we discussed earlier, counting every time a behavior occurs is called frequency recording. Duration would be how long each hit lasted. Partial interval would be if it happened at all within a small time window, and momentary time sampling is if it was happening at the exact moment you checked. Since you are counting every single time, frequency is the correct answer. If you are simply counting how many times something happens, use frequency. Question 9. What is the primary ethical responsibility of an RBT regarding client confidentiality? A. To share client information with anyone who asks. B. To discuss client information openly with family members, not primary caregivers, and friends. C. To protect client information and only share it with authorized individuals on the treatment team. D. To post progress updates on social media. Answer: C. to protect client information and only share it with authorized individuals on the treatment team. This question is about a fundamental ethical responsibility, keeping client information private. Confidentiality is crucial in ABA. It means you absolutely cannot share information about your client with anyone who isn't directly involved in their treatment and authorized to receive that information, like your supervisor or parents/caregivers, as directed. Options A, B, and clearly violate privacy. You must always protect your client's information as if it were your own most sensitive data. Remember, confidentiality is key. When in doubt, don't share and ask your supervisor. Question 10. When teaching a new skill, providing a prompt is designed to A. Prevent the client from engaging in the skill. B. Help the client make the correct response so they can be reinforced. C. Decrease the likelihood of the client learning the skill. D. Increase challenging behaviors. Answer. B. Help the client make the correct response so they can be reinforced. This question is about why we use prompts when teaching. A prompt is a hint or assistance you give to help the client perform the correct behavior. The main goal of prompting is to increase the chance that the client will respond correctly, allowing you to then provide reinforcement for that correct response. Reinforcing correct responses helps the client learn the skill. Prompts are temporary tools to help ensure success and access to reinforcement, not to prevent learning or increase problems. Prompts are like training wheels. They help the learner succeed while they are still learning. Question 11. What is the main purpose of a preference assessment? A. To determine the function of a behavior. B. To identify potential reinforcers. C. To measure the duration of a behavior. D. To assess academic skills. Answer. B. To identify potential reinforcers. This question is about the goal of a preference assessment. As we discussed before, a preference assessment is all about figuring out what a client likes. Why do we care what they like? Because things or activities they like are more likely to work as reinforcers. Things that will make a behavior happen more often if provided afterward. So the main purpose is to find items or activities that can be used as rewards to motivate learning and good behavior. It's not about why a behavior happens, function, how long it lasts, duration, or academics. Preference assessments are your tool to find what works as a motivator. Question 12. Which consequence involves removing a preferred stimulus immediately following a behavior, resulting in a decrease in that behavior in the future? A. Positive reinforcement. B. Negative reinforcement. C. Positive punishment. D. Negative punishment. Answer. D. Negative punishment. This question is asking you to identify a specific type of consequence based on its effect on behavior and what happens. The key parts are removing a preferred stimulus, something is taken away, and resulting in a decrease in that behavior. The behavior happens less in the future. Taking something away is negative in ABA terms, and the behavior decreasing means it's punishment. Putting those together gives you negative punishment. Positive reinforcement adds something to increase behavior. Negative reinforcement takes something away to increase behavior, and positive punishment adds something to decrease behavior. Negative punishment is like taking away a favorite toy because a child hit their sibling. Question 13. You are observing a client and record if a target behavior occurred at any point during a 10-second interval. What measurement method is this? A. Frequency. B. Duration. C. Partial interval recording. D. Whole interval recording. Answer. C. Partial interval recording. This question describes a specific type of interval recording. The key clue is if a target behavior occurred at any point during a 10-second interval. In partial interval recording, you break the observation time into small intervals and simply record if the behavior happened at all during that interval, even if just for a moment. Whole interval recording requires the behavior to occur for the entire interval. Frequency is counting, and duration is timing how long the behavior lasts. Because you are marking if it happened at any point in the interval, it's partial interval recording. Remember, partial means it just has to happen during part of the interval. Question 14. What is the primary role of the RBT in the behavior change process? A. To design and supervise all programs. B. To implement the behavior plan designed by the BCBA. C. To diagnose the client's condition. D. To conduct functional behavior assessments independently. Answer: B. To implement the behavior plan designed by the BCBA. This question is asking about the RBT's main job within the ABA team, while the BCBA, Board Certified Behavior Analyst, is responsible for designing the treatment plan, conducting assessments, and supervising. The RBT's core responsibility is to carry out that plan directly with the client. RBTs are the frontline staff who implement the strategies and collect data under the supervision of a BCBA. RBTs do not design plans, diagnose, or conduct complex assessments independently. Your role is crucial implementation. Question 15. When is it appropriate for an RBT to work without BCBA supervision? A. After 6 months of experience. B. When the client is making good progress. C. Never. D. When the RBT feels confident. Answer: C. Never. This question is about the RBT's required supervision. A fundamental ethical requirement for RBTs is that they must always work under the supervision of a qualified BCBA or BCABA. You are part of a team, and the supervisor is responsible for overseeing your work, ensuring the plan is implemented correctly, and guiding treatment decisions. Experience, client progress, or personal confidence do not remove the requirement for supervision. Supervision is non-negotiable for an RBT. Question 16. What is a discriminative stimulus, SD? A. A consequence that increases behavior. B. A stimulus that signals that reinforcement is available for a specific response. C. A stimulus that decreases behavior. D. Something the client dislikes. Answer: B. A stimulus that signals that reinforcement is available for a specific response. This question asks you to define an SD. An SD is like a signal or a cue. It's a stimulus that, when present, tells the individual that if they perform a specific behavior right now, they will get reinforced. For example, if saying "say ball," SD, to a child makes saying "ball" more likely because they usually get a ball afterward, reinforcement. Then it's "say ball" is an SD for the response "ball." It's a signal that sets the occasion for a behavior to be reinforced. Think of an SD as a green light for a specific behavior to get a reward. Question 17. Which type of chaining involves teaching the steps of a task analysis in order from the first step to the last? A. Forward chaining. B. Backward chaining. C. Total task chaining. D. Behavior chain interruption. Answer: A. Forward chaining. This question is about behavioral chaining, specifically the different ways to teach a sequence of steps, a task analysis. In forward chaining, you teach the first step first, prompt/help with the rest, and reinforce. Once the first step is mastered, you teach the first and second steps, and so on, building the chain from the beginning. Backward chaining teaches the last step first, and total task chaining teaches all steps at once with support. The description in order from the first step to the last perfectly describes forward chaining. It's like learning a song by starting with the first line and adding the next one once you know the first. Question 18. What is an antecedent? A. Something that happens immediately after a behavior. B. Something that happens immediately before a behavior. C. The consequence of a behavior. D. The function of a behavior. Answer: B. Something that happens immediately before a behavior. This question asks for the definition of an antecedent. In ABA, we often look at the ABCs. Antecedent, behavior, consequence. The antecedent is simply what happened right before the behavior occurred. It's the environmental condition or event that sets the stage for the behavior. It's not the behavior itself or what happens after the behavior. The consequence, for example, if a child screams, behavior, after the iPad is taken away. Antecedent. Taking away the iPad is the antecedent. Antecedents are what come before the action. Question 19. What is the purpose of taking data in ABA? A. To track billable hours. B. To make informed decisions about the client's program and progress. C. To provide busy work for the RBT. D. To report to the client's doctor only. Answer. B. To make informed decisions about the client's program and progress. This question is about why we collect data. Data is the foundation of ABA. We collect data to objectively measure how the client is doing. Is a skill increasing? Is a challenging behavior decreasing? This information is crucial for the BCBA to see if the current plan is working and to make decisions about whether to continue, change, or adjust the goals and strategies. Data isn't just for billing or doctors. It's primarily for guiding effective treatment decisions based on real evidence. Data helps us see if what we're doing is actually working. Question 20. Which type of data collection would you use to measure the time between two instances of the same behavior? For example, the time between the end of one tantrum and the beginning of the next tantrum. A. Latency. B. Duration. C. Interresponse time, IRT. D. Frequency. Answer. C. Interresponse time, IRT. This question asks for a specific type of measurement. The clue is the time between two instances of the same behavior. This describes interresponse time, IRT. Latency is the time from a stimulus to the start of the behavior. Duration is how long the behavior lasts. Frequency is a count. IRT is specifically the time that passes between one occurrence of a behavior ending and the next occurrence of that same behavior starting. It measures how often a behavior happens by timing the gap between occurrences. Think of IRT as the gap time between repeated behaviors. Question 21. What should you do if a client engages in a serious challenging behavior that is not addressed in the current behavior intervention plan, BIP? A. Implement a consequence you think might work. B. Document the behavior and immediately contact your supervisor for guidance. C. Ignore the behavior and hope it stops. D. Tell the client to stop the behavior. Answer. B. Document the behavior and immediately contact your supervisor for guidance. This question addresses what to do in a situation you haven't been trained for. Your scope of practice as an RBT means you only implement plans designed by your supervisor. If a challenging behavior occurs that isn't in the BIP, you do not make up your own strategy, a C or D. It is critical to ensure client safety and consistent intervention, so you must document what happened thoroughly and contact your supervisor immediately for instruction on how to handle it in the future. Your supervisor will update the plan. When in doubt or faced with something new or serious, contact your supervisor. Question 22. Which reinforcement schedule provides reinforcement for the first response after a specific fixed amount of time has passed? A. Fixed ratio, FR. B. Variable ratio, VR. C. Fixed interval, FI. D. Variable interval, VI. Answer. C. Fixed interval, FI. This question is about schedules of reinforcement. The key phrases are fixed amount of time and reinforcing the first response after that time. Fixed means the amount of time is the same every time, and interval means time is the key factor. So, fixed interval means reinforcement is available only after a set amount of time has passed, and the client gets reinforced for the very next correct response after that time is up. An example is getting paid weekly. You work all week, but you only get paid reinforcement after that fixed time, 1 week, has passed for the work you did. Question 23. What is shaping? A. Reinforcing closer and closer approximations to a desired behavior. B. Reinforcing a behavior only in certain situations. C. Teaching multiple steps of a task at once. D. Withholding reinforcement for a behavior. Answer: A. Reinforcing closer and closer approximations to a desired behavior. This question asks for the definition of shaping. Shaping is a teaching procedure used to teach a new behavior that the client doesn't currently do at all. You start by reinforcing any behavior that is similar to the target behavior, an approximation. Once the client reliably does that approximation, you stop reinforcing it and only reinforce behaviors that are even closer to the target behavior. You gradually shape the behavior towards the final goal by reinforcing successive approximations. It's like sculpting. You start with a rough shape and refine it bit by bit until you have the final form. Question 24. When should you communicate with your supervisor? A. Only during scheduled supervision meetings. B. Only when there is a major crisis. C. Regularly, as scheduled, and also whenever you have questions, concerns, or need guidance. D. Only when directed by the client's parents. Answer: C. Regularly, as scheduled, and also whenever you have questions, concerns, or need guidance. This question is about communication with your supervisor. Effective supervision requires regular, scheduled meetings to review data and progress. However, it's equally important to communicate outside of those times whenever you encounter something new, have questions about implementing the plan, observe significant changes, or need help. Don't wait for a scheduled meeting if you are unsure about something or something unexpected happens. Good communication ensures you are providing the best possible service and following the plan correctly. Your supervisor is your resource. Use them whenever you need support. Question 25. What is a mandatory reporter? A. Someone who reports client progress to their parents. B. Someone who is legally required to report suspected child abuse or neglect. C. Someone who reports data to the BCBA. D. Someone who documents session notes. Answer: B. Someone who is legally required to report suspected child abuse or neglect. This question asks about the term mandatory reporter. As an RBT working with vulnerable populations, often children or adults with disabilities, you are considered a mandatory reporter in many places. This means you have a legal obligation to report any suspicion of abuse or neglect to the appropriate authorities, like Child Protective Services or Adult Protective Services. It's not just about reporting progress or data within your team. It's a specific legal duty regarding safety. Know the signs of abuse/neglect and know your reporting protocol. It's a critical responsibility. Question 26. Which term refers to the increase in frequency, intensity, or duration of a behavior at the beginning of an extinction procedure? A. Generalization. B. Spontaneous recovery. C. Extinction burst. D. Discrimination. Answer: C. Extinction burst. This question describes a common phenomenon that happens when you start using extinction. When a behavior that used to get reinforced suddenly stops getting that reinforcement, extinction, it often gets worse before it gets better. The behavior might happen more often, harder, or last longer as the individual tries harder to get the reinforcement. This temporary increase is called an extinction burst. It's a sign that the extinction procedure is likely working. Don't give in during an extinction burst, or you'll accidentally reinforce the more intense behavior. Question 27. What is generalization in ABA? A. The behavior occurring less frequently over time. B. The behavior occurring in different environments, with different people, or with different materials than those used during teaching. C. The process of breaking a skill down into smaller steps. D. The increase in a behavior after reinforcement. Answer: B. The behavior occurring in different environments, with different people, or with different materials than those used during teaching. This question is about generalization, which is a very important concept. Generalization means that a skill or behavior learned in one specific situation, example, saying ball when shown a red ball by the RBT at the table, starts happening in other relevant situations. This could mean saying ball when seeing a blue ball, or when asked by a parent, or when seeing a ball outside. True learning isn't just doing something when prompted by one person in one room. It's being able to use the skill across different places, people, and things. We actively plan for and promote generalization. Question 28. You're teaching a client to wash their hands using a task analysis. You help them with the first step, turn on water, then prompt them through the rest of the steps. Once they master the first step, you have them do the first 2 steps, and so on. What type of chaining is this? A. Forward chaining. B. Backward chaining. C. Total task chaining. D. Shaping. Answer A. Forward chaining. This question provides an example of teaching a task analysis using a specific method. The description says you teach the first step first, then the first 2 steps, and so on. This is exactly the definition of forward chaining, starting from the beginning of the sequence and adding steps in their natural order as they are mastered. Backward chaining would teach the last step first, and total task chaining would attempt all steps with prompting throughout. This is a clear example of building the chain from the front. Question 29. What is the purpose of using probes during skill acquisition? A. To reinforce the client for correct responses. B. To check if the client can perform a skill without any prompts. C. To take a break from teaching. D. To punish incorrect responses. Answer B. To check if the client can perform a skill without any prompts. This question is about using probes, often done before or during teaching a new skill. A probe is when you present the instruction or cue for a skill without providing any prompts or reinforcement, unless the client performs the skill completely independently. The purpose is to see if the client can do the skill on their own already, or to measure their independent performance as they are learning. It helps you see if the teaching is leading to independent mastery. Probes are like little tests to see what the client can do on their own. Question 30. When documenting a session note, what type of language should you use? A. Opinion-based and subjective language. B. Professional, objective, and descriptive language. C. Emotional and informal language. D. Language that blames others for challenging behavior. Answer B. Professional, objective, and descriptive language. This question is about how to write session notes. Session notes are professional documents that communicate important information about the session. They must be objective, based on facts, not feelings or opinions, descriptive, clearly explaining what happened, and professional. Avoid making assumptions using informal slang, expressing personal feelings, or blaming anyone. Stick to the observable facts and behaviors. Good session notes are factual accounts of the session. Question 31. What is a token economy? A. A system where clients earn tokens for specific behaviors, which can later be exchanged for backup reinforcers. B. A system where clients earn money for good behavior. C. A method for punishing challenging behavior. D. A way to track frequency data. Answer A. A system where clients earn tokens for specific behaviors, which can later be exchanged for backup reinforcers. This question defines a token economy. In a token economy, clients earn generalized conditioned reinforcers, like tokens, points, stickers, etc., immediately after performing a desired behavior. These tokens don't have value themselves, but they can be traded in later for things that are reinforcing to the client. Backup reinforcers, such as screen time, toys, or activities. It's a system designed to bridge the gap between the behavior and a larger reward, making reinforcement more immediate. Tokens are like earning points towards a prize. Question 32. Which function of behavior is maintained by gaining access to tangible items or activities? A. Attention. B. escape/avoidance. C. Access to tangible/activity. D. Automatic, sensory. Answer: C. Access to tangible/activity. This question is asking about the function of a behavior, specifically what the individual gets from doing the behavior. If a behavior happens because the person gets something they want, an item or an activity, then the function is access to tangibles or activities. For example, a child whining, behavior, until they get a cookie, tangible item, has the function of access to tangible. It's one of the 4 main reasons why challenging behaviors occur. The behavior gets them something they can see or touch, or do. Question 33. What should you do if a client asks you to keep a secret about something important, like them being hurt? A. Agree to keep the secret to build rapport. B. Tell the client you cannot keep secrets that involve safety or harm and report it immediately to your supervisor. C. Only tell the client's parents. D. Document it in the session note, but don't tell anyone. Answer: B. Tell the client you cannot keep secrets that involve safety or harm and report it immediately to your supervisor. This question touches on ethical boundaries and mandatory reporting. You must build trust with clients, but your primary responsibility is their safety and welfare. You can never agree to keep a secret that involves potential harm to the client or others. It's important to explain in simple terms that some things cannot be secrets, especially when it comes to safety, and then immediately follow your agency's protocol for reporting, which includes telling your supervisor right away. Your ethical duty is to report, not to keep harmful secrets. Question 34. When measuring a behavior, what is inter-observer agreement, IOA? A. The number of times the behavior occurred. B. The percentage of intervals where 2 observers agreed on whether the behavior occurred. C. How long the behavior lasted. D. The time between behaviors. Answer: B. The percentage of intervals where 2 observers agreed on whether the behavior occurred. This question asks about inter-observer agreement, or IOA. IOA is a way to check if the data you are collecting is accurate and reliable. It involves 2 independent observers collecting data on the same behavior at the same time. IOA is calculated by comparing their data and seeing how often they agreed on whether the behavior happened, or how many times, or how long, depending on the measurement type. A high IOA percentage means your data is reliable because different people observing the same thing got similar results. IOA helps make sure your data isn't just based on one person's perception. Question 35. What is discrimination training? A. Teaching a behavior to occur in all environments. B. Teaching a client to tell the difference between 2 or more stimuli and respond differently to each. C. Reinforcing every instance of a behavior. D. Gradually reducing the level of prompting. Answer: B. Teaching a client to tell the difference between 2 or more stimuli and respond differently to each. This question asks for the definition of discrimination training. The word discrimination here means being able to differentiate or tell things apart. In ABA, discrimination training teaches a client to respond only when a specific stimulus, the SD, is present and not respond or respond differently when a different stimulus, an S delta or SD, is present. For example, teaching a child to touch a picture of a dog when you say touch dog, SD, but not touch it when you say touch cat, SD. You reinforce the correct response to the SD and don't reinforce the response to the SD. It's teaching them to respond to the right signal. Question 36. Which function of behavior is maintained by escaping or avoiding a task, situation, or person? A. Attention. B. Escape/avoidance. C. Access to tangible/activity. D. Automatic, sensory. Answer: B. Escape/avoidance. This question describes the function of a behavior. If a behavior happens because the person wants to get away from something unpleasant or difficult, That's the escape or avoidance function. For example, a child ripping up their worksheet behavior might be reinforced if it results in the teacher taking the worksheet away, escape from the task. The behavior allows them to escape something they don't like or want to avoid. The behavior helps them get out of something. Question 37. What is the purpose of conducting a functional behavior assessment, FBA? A. To teach new academic skills. B. To determine the purpose or function of a challenging behavior. C. To measure the frequency of a behavior. D. To conduct preference assessments. Answer: B. To determine the purpose or function of a challenging behavior. This question asks about the goal of an FBA. A functional behavior assessment is a process used to figure out why a challenging behavior is happening. It aims to identify the function of the behavior, what the client gets or avoids by doing it. Knowing the function, attention, escape, tangibles, sensory, is crucial because it helps the BCBA design an effective intervention plan that addresses the reason for the behavior, not just the behavior itself. An FBA helps you understand the why behind the behavior. Question 38. Which schedule of reinforcement is least likely to produce a pause in behavior after reinforcement is delivered? A. Fixed ratio, FR. B. Variable ratio, VR. C. Fixed interval, FI. D. Variable interval, VI. Answer: B. Variable ratio, VR. This question is about how different reinforcement schedules affect response patterns. Fixed schedules, FR and FI, often result in a pause in responding right after the reinforcement is delivered, a post-reinforcement pause. Variable schedules, VR and VI, where the requirement changes unpredictably, tend to produce steady, high rates of responding with little to no pausing, because the client never knows exactly when the next reinforcement is coming, encouraging them to keep trying. Variable ratio schedules, in particular, are known for producing high, steady rates of behavior with no pause, like gambling. Question 39. You are working with a client who engages in hand flapping. This behavior seems to occur regardless of what is happening around them, and they seem to enjoy the sensory input from it. What function is this behavior most likely serving? A. Attention. B. Escape/avoidance. C. Access to tangible/activity. D. Automatic. Sensory. Answer: D. Automatic. Sensory. This question provides an example of a behavior and asks about its function. The description says the behavior happens regardless of what is happening around them, and that the client seems to enjoy the sensory input. This points to the automatic or sensory function. Behaviors maintained by this function are internally reinforcing. They produce a feeling or sensation that the individual finds rewarding, without needing anything from the external environment, like attention from others, escape from demands, or access to items. The behavior itself is the reinforcement. Question 40. What is the ethical principle of do no harm? A. Only work with clients who are easy to manage. B. Ensure that your actions and interventions do not put the client at risk of physical or psychological harm. C. Avoid working with clients who engage in challenging behavior. D. Report any instance of client progress. Answer: B. Ensure that your actions and interventions do not put the client at risk of physical or psychological harm. This question is about a core ethical principle in any helping profession, including ABA. Do no harm means that everything you do should prioritize the client's safety and well-being above all else. This includes implementing procedures correctly, avoiding punishment procedures that could cause harm, maintaining confidentiality, and being aware of and preventing potential risks. Your actions should always protect the client. This principle is sometimes referred to as non-maleficence. Question 41. What is the correct procedure for reporting suspected child abuse or neglect? A. Tell the client's parents first. B. Contact local law enforcement directly without telling your supervisor. C. Follow your agency's specific protocol, which typically involves reporting to your supervisor immediately, who will then guide you on making a report to the appropriate authorities. D. Wait until you have undeniable proof before reporting. Answer C. Follow your agency's specific protocol, which typically involves reporting to your supervisor immediately, who will then guide you on making a report to the appropriate authorities. This question builds on the mandatory reporter concept. While the legal requirement is to report, how you report is dictated by your agency's policy. Most agencies require you to report your suspicion to your supervisor immediately. Your supervisor is responsible for ensuring the report is made correctly and promptly to the relevant child or adult protective services and/or law enforcement, as required by law. You do not need undeniable proof, and you should not delay or try to handle it yourself outside of the proper channels. Report up the chain of command within your agency as the first step. Question 42. When documenting a session, what information should be included in your session note? A. Your personal feelings about the session. B. Gossip about the client's family. C. Objective data collected, summary of activities, client's overall behavior, and any significant incidents. D. Plans for future sessions. This is the BCBA's role. Answer C. Objective data collected, summary of activities, client's overall behavior, and any significant incidents. This question asks about the content of a session note. As discussed earlier, session notes need to be objective and professional. They should include the factual data you collected, like frequency counts or percentages, a brief summary of what you worked on, a general description of how the client was doing behaviorally, and details about any notable events or challenging behaviors that occurred. Avoid including personal opinions, rumors, or making plans for future sessions. That's the BCBA's job. Stick to the facts of this session. Question 43. What is prompting? A. Providing reinforcement. B. Withholding reinforcement. C. Providing assistance or cues to help a client perform a behavior. D. Measuring behavior. Answer C. Providing assistance or cues to help a client perform a behavior. This question defines prompting. A prompt is any type of help you give the client to encourage them to make the correct response. This help can come in many forms, like telling them what to do, verbal prompt, showing them what to do, model prompt, guiding them physically, physical prompt, or pointing, gestural prompt. Prompts are used to help the client be successful so they can access reinforcement and learn the skill. Prompts are temporary aids to facilitate learning. Question 44. What is the gradual removal of a prompt after the client begins to perform the behavior independently? A. Prompting. B. Shaping. C. Prompt fading. D. Generalization. Answer C. Prompt fading. This question describes prompt fading. Once a client starts successfully performing a skill with a prompt, the next step is to gradually reduce or remove that prompt. This process is called prompt fading. It's essential because you want the client to perform the behavior based on the natural cue, the SD, not rely on your prompt forever. Prompt fading ensures the client becomes independent. Think of it like slowly removing the training wheels once someone learns to ride a bike. Question 45. Which dimension of behavior refers to the physical space a behavior occupies or the movement required? A. Frequency. B. Duration. C. Topography. D. Latency. Answer C. Topography. This question asks about a specific dimension of behavior. Topography refers to the form or physical shape of the behavior. It describes what the behavior looks like, while frequency is how often it happens, duration is how long it lasts, and latency is the time to start. Topography is about the movements and actions involved. For example, the topography of a tantrum might include screaming, kicking, and hitting the floor. It describes the physical appearance of the behavior. Question 46. What is the ethical responsibility of an RBT regarding their own competence? A. To only work with clients they feel comfortable with. B. To practice only within their training and supervision and seek help if unsure. C. To accept any case offered, regardless of experience. D. To decide which clients need which services. Answer: B. To practice only within their training and supervision and seek help if unsure. This question is about working within your limits as an RBT. Your competence is defined by the training you've received and the supervision you have. You should only implement procedures and work with clients under the direct guidance of your supervisor. If you are ever asked to do something you haven't been trained for, or you are unsure how to handle a situation, it is your ethical duty to not proceed and instead ask your supervisor for help and guidance. Don't try to figure it out on your own. If it's outside your expertise, ask your supervisor. Question 47. Which measurement procedure involves dividing an observation period into intervals and recording if the behavior occurred at the very end of each interval? A. Partial interval recording. B. Whole interval recording. C. Momentary time sampling. D. Duration recording. Answer: C. Momentary time sampling. This question describes a specific type of interval recording. The key is recording if the behavior occurred at the very end or exact moment the interval finishes. This is momentary time sampling. Partial interval records if it happens at any point in the interval, and whole interval records if it happens for the entire interval. Momentary time sampling gives you a snapshot of whether the behavior is happening right at that specific moment you check. Think of it as checking your watch at the end of the interval and marking if the behavior is happening right then. Question 48. What is the goal of teaching replacement behaviors in a BIP? A. To give the client something else to do instead of the challenging behavior. B. To punish the challenging behavior. C. To ignore all behaviors. D. To increase the challenging behavior. Answer: A. To give the client something else to do instead of the challenging behavior. This question is about a key part of most BAPs, teaching replacement behaviors. Simply trying to stop a challenging behavior isn't usually enough. The individual needs a functional, appropriate way to get their needs met. Replacement behaviors are appropriate behaviors that serve the same function as the challenging behavior, but are more acceptable. For example, teaching a child to ask for a break instead of screaming to escape a task. The goal is to replace the unwanted behavior with a better one that serves the same purpose for the individual. Question 49. Which of the following is an example of positive reinforcement? A. A child's whining decreases after their parent ignores it. B. A student completes their homework to avoid losing recess. C. A person gets praise immediately after saying thank you, and they say thank you more often in the future. D. A teenager loses their phone after staying out past curfew, and they come home on time in the future. Answer: C. A person gets praise immediately after saying thank you, and they say thank you more often in the future. This question asks you to identify an example of positive reinforcement. Positive reinforcement involves adding something positive after a behavior occurs, which results in the behavior happening more often in the future. Reinforcement. In option C, praise. Something is added, follows saying thank you, and the result is saying thank you more often. Option A is extinction. Option B is negative reinforcement, escaping loss of recess. Option D is negative punishment, losing phone. Positive reinforcement adds something good to increase a behavior. Question 50. If a client's parent asks you for your personal opinion on their child's diagnosis or treatment plan, what should you do? A. Share your opinion freely as you work closely with the child. B. Tell the parent you are not qualified to discuss diagnosis or make changes to the treatment plan, and direct them to speak with the BCBA supervisor. C. Discuss it briefly but avoid technical terms. D. Change the treatment plan based on their questions. Answer: B. Tell the parent you are not qualified to discuss diagnosis or make changes to the treatment plan, and direct them to speak with the BCBA supervisor. This question is about maintaining professional boundaries and operating within your scope of practice. RBTs are trained to implement plans, not diagnose or design them. Providing opinions on diagnosis or suggesting changes to the treatment plan is outside your role. It's essential to politely and professionally explain that those discussions are handled by the BCBA who designed the plan and is responsible for treatment decisions, and offer to help them connect with the supervisor. Know your role and refer clinical questions to your supervisor.